Hee-haw! Before the Affordable Care Act, it was the Wild West out here in healthcare. And you think I'm joking. Heck no! In the 1960s, you could get a policy for 6 people, 2 adults, 4 children, $30 a month, and you never paid a dime to see the doctor. And half the time in small towns, they came to your house, took your kid's temperature, gave you a prescription for an antibiotic, or called it into the pharmacy. They'd come to your house and deliver the prescription. It was amazing. Except there is this whole sort of sticky wicket called pre-existing conditions.
Uh-oh.
So, I have a disorder called spherocytosis. My blood cells look like a messed up donut. I've got a pre-existing condition. And while my spleen was removed, the risk is maybe, operative word, maybe 5 high fevers in your lifetime. The average person that has had their spleen removed will get 5 high fevers that potentially would cause them to go to the emergency room. So I'm considered an expensive risk to them. In the 70s and 80s, I was an expensive risk. Now, because insurance was through my mother's employer, which was the state of Wisconsin, there were no problems. Because in America, with your employer, you can have any pre-existing condition in the world, and your employer has to automatically provide you with insurance. In 2013, before the Affordable Care Act was passed, your pre-existing condition doesn't matter. But if you're a consultant and you do not work for a big employer, you do not have access to those plans. If you do get a condition, I'm going to use me as an example. So I'm already excluded, so I have this junky policy, but Minnesota is a great state. It's slightly socialist, so they do have safety nets for people that had pre-existing conditions and didn't qualify for insurance. It was very expensive, so it's not like I didn't pay an arm and a leg for my son and I, because he also has spherocytosis. We were slated into this Minnesota-based plan, and it was expensive, but we had coverage, so it was better than no coverage. But I got cancer. So in 2005, if you got cancer, and that's like a signifying event, and that signifies to the insurance company that you are going to cost them a lot of money, because cancer is big, big business in America. Say your husband left his job in 2006, you had COBRA for 2 years. In 2008, you don't have COBRA anymore, and you don't have any insurance, and you've got a pre-existing condition, and you don't live in a state like Minnesota. Do you know what happens?
You've got a problem.
You don't have any insurance. And do you know what that means? That means that the insurance entire system is out to screw you. Everybody without insurance, even now that's just paying their federal fine or whatever, thinking it's no big deal, you are charged more if you do not have health insurance for a procedure, even if it's to remove a wart. Your procedure is going to be more expensive by at least 50%, if not more, than a person that has insurance, because qualifying events are covered by your insurance company, and they knock off a big chunk of the charge that the doctor has levied.
They've got this thing called a charge master price list, which a lot of people don't know about, and they don't talk about it. But the bottom line is, if you're not with an insurance plan, you might think, oh, well, this isn't too bad. I'll just, I'll pay whatever it costs, and you figure it, you're going to pay what the insurance company would have paid. Well, that's not the case. If, say you go in and you get some ibuprofen with whatever happens, all right, if you have insurance, they may charge the insurance company $5 for that ibuprofen. If you don't have any insurance and you go in, that ibuprofen is suddenly going to cost you between $10 and $15. Same ibuprofen, same stuff. You can go down to Walgreens for, pennies per pill, but they're gonna rack up that price because they can, and it's more profit for them.
The system's set up to really screw everybody.
It's a double hit, because you probably already are in bad financial shape, but that's why you're not paying for insurance. Now they're going to charge you double of what you would have paid for the procedure.
In our next session of America for Non-Americans, we will address Obamacare, or the Affordable Care Act, and how that has changed the healthcare industry in the United States. Thanks for visiting and comment below.